And thank you so much for inviting me here today at this exciting seminar on the very important topic of women's health. My name is Martina Slingsby, and I'm a principal scientist at Alnylam Pharmaceuticals, which is a mid-sized biotech company in Cambridge, Massachusetts. And it was fun to see Dr. Rosen's picture of the biotech CEOs in pink at the JP Morgan conference. And I zoomed in and I saw the CEO of our company, Alnylam Pharmaceuticals, in the very center of that picture, Yvonne Greenstedt. So it's a big inspiration, and I hope to be in that picture one day. So today I'm going to give a summary of my previous academic research at the University of Copenhagen, where I studied the cardiovascular effects of exercise in pre- and postmenopausal women, conducted as part of the Copenhagen Women study. I will then briefly talk about my current biotech research at Alnylam on ALN 6400, which is an investigational new drug for bleeding disorders that I've had the privilege of being involved with ever since the idea stage, and it's now in clinical trials, and on how this relates to women's health. So the Copenhagen Women study investigated the effects of high-intensity training on cardiovascular risk factors in pre- and postmenopausal women. And the background to this is that women experience an increased risk of cardiovascular events after menopause due to the loss of estrogen. It is unknown how, or it was previously unknown before this study, how physical activity affects the cardiovascular system in women after menopause, since most of the studies had been performed in men or in younger premenopausal women. So the aim was to examine the effects of regular aerobic exercise in late premenopausal and recent postmenopausal women, in order for age not to be a factor, since age is a known risk factor for cardiovascular disease. So we wanted these women to be as close in age as possible. And I was part of the team that investigated heart function, platelet function, which was the effort I was leading, and also blood vessel function. But also to say that this Copenhagen Women study was a multidisciplinary study where these women underwent a lot of testing, also of their insulin sensitivity, sugar handling, fat composition and muscle function, also psychological aspects of the menopausal transition. But today I will mainly focus on the cardiovascular aspects, and particular on platelet function. So why study platelet function? What are platelets? Well, they're often referred to as the band-aids of the blood, essential for the repair of blood vessels, or also called hemostasis, the halting of the blood, where platelets are the kind of first on site, forming a clump and a seal over the vessel wall injury. So a band-aid, if you wish, to stop bleeding and prevent blood loss. But excessive platelet clumping can form a blood clot that may block blood flow and could lead to a heart attack, or also known as thrombosis. So it's important to have a healthy balance in platelet activation, where you want platelets to be able to activate and stop bleeding, but not excessively, so not to cause blood clots. And platelets are kept in their resting state by the, as I refer to, keep calm and carry on mediators, prostacyclin and nitric oxide, that are continuously released from the inner lining of blood vessels, which are the endothelial cells. So there's a constant communication between blood vessels and the blood. And endothelial dysfunction is a dysfunction of this inner lining of blood vessels, which can reduce the amount of nitric oxide and prostacyclin being released from the blood vessels. And that can result in an altered regulation of the platelets and increase the risk of platelets becoming too activated and increasing the risk of a blood clot. And endothelial dysfunction typically accelerate after the age of 40 in men, but in women, this is slightly delayed and typically accelerates after the age of 50, after the onset of menopause and the loss of estrogen. So the research question I wanted to investigate in this study was if regular physical activity can prevent or delay endothelial dysfunction and thereby improve the regulation that the blood vessels do of platelets, keeping them in their keep calm and carry on state. So in this study, we included 25 sedentary, but they were all healthy and had no chronic illnesses, late premenopausal women, so they were on average aged about 49. And then we included 24 closely matched, recently postmenopausal women. So they were about 53 years old, so only about a 4-year age difference, really keeping the age gap to a minimum. But they still had, they only had their last menstrual period about 3 years ago. So they were clearly postmenopausal. And they underwent supervised spinning training, 1-hour sessions with high intensity interval training, where they have several intervals above 80% of their maximum heart rate, monitored by heart rate monitors, so we could follow their pulse for the entire training session, 3 times a week for 3 months. And they were brave women who had a wide range of tests performed before baseline, did this spinning intervention, and then came back to perform the same tests after the training. And the training intervention had the expected effect in terms of it improved their aerobic capacity or fitness level, measured with a gold standard test, which is called VO2 max, which improved in both the pre- and postmenopausal women after the training intervention. And here we have some subject characteristics, and I got the table to the right. But if we focused more on my summary to the left, you can see, as I pointed out, they were closely age matched. There was only about a 4-year age difference. They had similar normal BMI and weight. And the postmenopausal women had the expected hormonal profile, meaning they had minimum estrogen levels and higher follicle stimulating hormone and luteinizing hormone levels, which are kind of hallmark of the being in menopause. But interestingly, even if they were so closely age matched and were otherwise healthy, the postmenopausal women had higher blood pressure at baseline. They were still normotensive, so they didn't have high, kind of medically high blood pressure, but it was still higher and it was lowered with training. And they also had higher cholesterol total and bad cholesterol, LDL, that was also reduced with training. And this is summarized in this publication here. And then briefly to mention the experiments that my colleague, Dr. Jon Egelund, performed, who looked into the effects on the heart on exercise training. And an echocardiogram, so a sort of non-invasive imaging of the heart, showed that in both the pre- and postmenopausal women, the exercise training increased the heart size of the left ventricle. So this is the main pumping chamber of the heart, and improved heart function. So the ability of the heart to relax and fill with blood between beats. So to my main research questions, do postmenopausal women have more reactive platelets? To answer this, we took blood samples from the arm and we performed a platelet function test where we isolated the platelets from the blood and activated them, added platelet activators to make them clump together. And these experiments were performed together with my master student, Laura Möller Jensen. And here you can see a graph showing a platelet function test. And if you focus on, so premenopausal women are shown in black and postmenopausal in gray, you can see that the gray curves are slightly shifted to the left, meaning that less platelet activator was needed to activate the platelets from the postmenopausal women. So it did appear that they did have slightly more reactive platelets than the premenopausal women. And this actually didn't change at baseline with the exercise training. But interestingly, the exercise interventions seem to make the platelet from both the pre- and postmenopausal women more easily inhibited by things released from the blood vessels. So here you can see a woman sitting in our kind of acute exercise chair test, where she is actively kicking her leg forward with a weight. And Dr. Mikael Nyberg is performing ultrasound to measure the blood flow, and we were able to take blood samples from this leg. And you can see that suddenly the gray curves are shifted downwards, sort of to the right and downwards, in both the premenopausal women and in the postmenopausal women, meaning that their platelets got slightly inhibited by this acute exercise, and more so after the training intervention. So question is if that could mean that they may have an improved endothelial function after the exercise intervention, and perhaps more of the nitric oxide and prostacyclin, these platelet inhibitors, being released from the blood vessels into the bloodstream by the acute exercise. So now over to the blood vessel function tests in this study. For these experiments, which were performed by, again, Dr. Jon Egelund and our professor, Ylva Hellsten, and postdoc Mikael Nyberg, where very invasive, unique experiments were performed, where a catheter was inserted into the main artery of the leg, where we could infuse drugs into the leg and measure blood flow in response to those drugs. And we could take blood samples from a catheter inserted into the vein of the leg to really measure how the leg and the blood vessels in the leg responded to that localized infusion. And you can see, as summarized in this publication here, that postmenopausal women had reduced prostacyclin-induced vasodilation. So when we fused prostacyclin, their blood vessels didn't dilate to the same degree as the premenopausal women. So you can see their curves are slightly lower than the premenopausal women. But encouragingly, this improved after training. So now their blood vessels are functioning more similarly to the premenopausal women. And to this same prostacyclin infusion, when we tested their platelet functions, we saw that the platelets also became more easily inhibited by this same prostacyclin infusion after the exercise training, which could help their platelets keep them in their keep calm and carry on state, and just monitoring the blood vessels for injuries, but really trying to avoid them clumping together too much and causing blood clots and thrombosis. And that's summarized in this publication here. So the take-home message is that introducing pre- and postmenopausal women to regular exercise had an impressive amount of effects on their physiology in their bodies. It strengthened their heart function, improved blood vessel function, and made their platelets more easily inhibited. So kept them in that keep calm and carry on inactive state. And overall, these improvements may help reduce the risk of cardiovascular disease, also in the postmenopausal women who kind of statistically have an increased risk of cardiovascular disease after menopause. So I'd like to thank all the fantastic women that bravely participated in this study, and for all the blood, sweat, and tears, and for everyone at the University of Copenhagen, our collaborators in London, and for our funding. And I will now switch gears and talk about my current work with ALN 6400, which is an investigational drug for bleeding disorders that I've had the privilege of being part of ever since the idea stage, and it's now a dream come true to bring this to the clinic, and I hope that it will go all the way to patients. Gives you some background. So majority of bleeding disorders lack treatment options, and we hope that ALN 6400 have a potential to become a universal hemostatic agent, meaning a blood-reducing agent. And bleeding disorders experience a high degree of anemia and emergency room visits, anxiety and depression, and sort of really impact the quality of life. They can have major bleeding events that can sometimes be fatal, and have a higher degree of hospitalizations and healthcare utilization. And there are about 3 million people in the US affected by bleeding disorders. And unfortunately, the existing treatment options are burdensome and can increase the risk of thrombosis. And to give a bit of perspective of how this relates to women's health is that women with bleeding disorders have the extra dimension of bleeding monthly in their menstrual period, and many of them have heavy menstrual bleeding, and that can make them extra vulnerable to become even more anemic and even more anxious and depressed and needing more health care and suffering more. So we hope that ALN 6400 will help a lot of women with bleeding disorders, but also men. And the mechanism of action is that ALN 6400 is a small interfering siRNA. This is the kind of the hallmark, the technology that we do at Alnylam. And this is a subcutaneous injection that goes to the liver and blocks and reduces the production of plasminogen into the bloodstream. And plasminogen is the main driver of fibrinolysis, or clot breakdown, that basically breaks down the fibrin mesh that holds blood clots together. So by reducing plasminogen level, we aim to stabilize and prolong these kind of sealing blood clots to basically stay there for longer and repair the blood vessel and reduce bleeding. And there is some clinical validation provided by the small molecule or tablet tranexamic acid, which is a plasminogen activation inhibitor. So it kind of acts on the same pathway that's inhibiting the conversion of plasminogen into plasmin that drives fibrinolysis. And this is a drug that is currently approved, has been used for a very long time in Europe and in the US. It is approved for treating heavy menstrual bleeding and frequently used off-label to treat a variety of bleeding disorders. But the downsides is that it's got a very high pill burden. You need to take 6 tablets a day, 2 tablets every 8 hours, every day, and it has peaks and troughs in how it acts, so you're kind of left vulnerable in between. And it can also have off-target side effects that can limit its use and tolerability. So we are currently performing a phase 1 study with ALN 6400 in healthy volunteers, in both men and women, and where the primary objective is to evaluate the safety and tolerability of single doses of this subcutaneous injection of ALN 6400. And excitingly, this is my last slide, just to share that we have initial proof of mechanism, meaning that ALN 6400 is so far, based on the tests I'll show you, working as we expect it to work on the blood and on fibrinolysis in the blood. So for this, we use this clinical whole blood assay called ROTEM, where you can study, you can have some blood and you can study blood clot formation and clot breakdown or fibrinolysis over time. And you can see that here is example traces of a healthy volunteer that was dosed with placebo over different time points. You can see that they have very consistent ROTEM traces showing rapid clot formation and then breakdown. But here is a healthy volunteer that has been dosed with ALN 6400. You can see that by day 15, there's a sort of a shift in the trace that's deepening by day 29 and sustained by day 43. And this is an antifibrinolytic effect, meaning that clot breakdown or fibrinolysis is delayed. And we hope that this will eventually translate into a reduction in bleeding in patients with bleeding disorders. And we are currently planning phase 2 studies in a bleeding disorder in patients to start in the second half of 2025. So this is very exciting and a dream come true for me to work on. And I'll stop sharing now.
Thank you so much for that, Dr. Martina Slingsby.